Hello, I'm Dr. John Perlin, President and CEO of the Joint Commission.
And I'm Stephanie Mercado, CEO of NAHQ, the National Association for Healthcare Quality.
We're here to make a very exciting announcement. NAHQ and the Joint Commission have just formed a strategic alliance that will have a global impact on the delivery of safe, high-quality, and equitable healthcare for all.
As an industry, we have made a lot of progress making sure that every patient receives high-quality, safe care. But there's more work to be done. Together, NAHQ and the Joint Commission will focus on helping to develop the most powerful resource in healthcare, the professionals who make up our diverse workforce. The workforce is healthcare's greatest investment, and the time has come to unleash its human potential.
So, what's the importance of this alliance? Well, first, it aligns two organizations that are leaders and the very best in class in what they do. There is no organization like NAHQ, and certainly no organization that has developed a competency framework for quality leaders that has led to direct improvement in patient outcomes. We recognize and we endorse what NAHQ is doing, and we believe it should be adopted across the industry.
And likewise, for over 70 years, the Joint Commission has been leading the accreditation and certification for healthcare organizations. Their work across the United States and around the world raises the bar not just on what is necessary for accreditation, but what's most important for patients. And now, their work is setting the standard and providing guidance for other important areas like healthcare equity, sustainability, and the responsible use of health data.
With this alliance, we will do that in three bold and transformative ways. First, aligning to a universal set of quality competencies by endorsing the Healthcare Quality Competency Framework. Second, by supporting the skilling of individuals and coordinating teams by endorsing the CPHQ, the only accredited credential in healthcare quality. And third, by providing the right training and the right education on today's most critical topics. Let's talk more about these, Stephanie.
Well, first, aligning to a universal set of quality competencies is critical to leveling up and coordinating the workforce. We will never achieve our shared goals without a shared framework. NAHQ has created and validated the Healthcare Quality Competency Framework, which defines the full spectrum of work required for a high-functioning quality program. We have data that shows when we raise the competency of quality professionals by aligning them to this framework, organizations are achieving the results they desire.
And importantly, those data show that patient outcomes improve as well. The Joint Commission will endorse NAHQ's Healthcare Quality Competency Framework, and we will work with NAHQ to encourage organizations to implement it through NAHQ's Workforce Accelerator program.
Second, we know that credentials play a critical role across healthcare to help define the necessary knowledge and skills and to prepare and identify those who are most committed and most competent in their roles. Many organizations already require the CPHQ for their quality staff, and NAHQ's peer-reviewed research has shown that those who hold the CPHQ function at higher levels of the competency framework than their non-CPHQ peers, and this is true across all 8 domains of the framework.
That's why the Joint Commission encourages quality professionals to get their CPHQ. And we're taking it one step further. We're developing a timeline for the Joint Commission's own surveyors to obtain and maintain CPHQ certification themselves. We know we'll have more efficient and effective conversations during the surveys and reviews if everyone on the team is grounded in this best-in-class framework and speaks the same quality language. I also want to mention that together, NAHQ and the Joint Commission will offer 25 CPHQ annual scholarships to people working in underserved communities, putting this valuable certification in reach of the most dedicated and deserving health professionals.
And third, we will focus on bringing the most relevant and timely education to the workforce. NAHQ is creating a series of micro-credentials aligned to each of the 8 domains of the Quality Competency Framework. NAHQ and the Joint Commission are going to collaborate to develop a micro-credential in regulatory and accreditation. It's so important right now to help those working in compliance understand that their work is about much more. We want to connect the dots for them so that they can see how compliance fits into advancing quality excellence.
And achieving quality excellence, improving care, ensuring patient safety, that's what this alliance is all about. This alliance will help us to elevate care together.
And for NAHQ, aligning with the Joint Commission will significantly accelerate our efforts, driving common competencies, skilling individuals, and coordinating teams. And our research tells us it's going to be effective.
I can't wait to see the transformational effect that this alliance will bring for healthcare professionals and, most importantly, for patients.
And I can think of no better organization to work with. Together, we will make a powerful and lasting impact.